Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crow, Director of Professional and Community Education at Care Dimensions. And it's my honor, as always, and this is Bob Hagopian. He is our Bereavement Coordinator out of Greater Boston for Care Dimensions. And we have had him on the show before because he is just amazing. And Bob, it is so great to have you here today.
Thank you, Mary. It's wonderful to be back with you again, and right back at you. You are amazing, too.
Thank you so much,
Thank
Bob.
you.
Well, I want you to, for those who haven't had the honor, really, of getting to know you through this show, please, if you could introduce yourself to them.
Of course. Well, I'm a retired pastor, 26 years in ministry. I've been in the hospice field for about 14, over 9 of those years with Care Dimensions, which I've thoroughly enjoyed. And I really feel this is my niche. This is who I am. I'm also a retired firefighter. I'm still a fire and police chaplain. I've dealt with a lot of trauma and a lot of loss. And through it all, I feel honored to be helping people get through.
Yeah, and you certainly do that, Bob.
Thank
and
you.
again, we're grateful for all of your service. Thank you.
Thank you. You're welcome.
You know, today we're going to talk about grief and loss. I want to talk about bereavement and the services that, you know, we certainly offer through Care Dimensions on that, but let's talk about grief and loss, and then we'll go into that, if you will.
Sure.
So, you know, what I like to talk to the audience about is some people, they don't even understand the terms. They'll use grief, they'll use mourning, they'll use them interchangeably. Let's talk about definitions, just so that we're all on the same page with that.
Absolutely. Many people think they're synonymous.
Yes.
They're obviously connected. They're related.
Yeah.
But grief is the inner feelings that we have, and the exhibition of behaviors, types of thinking, words. You know what we're going through because we're in shock. We've lost someone that maybe a parent that we've known all our life, or a spouse who we were very devoted to. Grief is the feeling, the emotion, and its physiological impact on our body and mind. Mourning is a period of time where we're outwardly showing that we have had a loss. And mourning is also attached to many different traditions, both religious and cultural. The wearing of black, you know, that is normally the color of mourning, of grief. And there may be certain customs, for instance, in the Jewish tradition, the sitting Shiva. You know, there are things that help us mourn outwardly with the people around us who we love and who also are in mourning for the loss that we've experienced.
And that's important, too, for us all to understand, because we don't all do it the same way.
Right.
And it's because we're all so different, and the cultural differences. Oftentimes when people hear culture, they think just ethnicity.
Right.
Ethnicity is one component, but there's so many others.
Oh, absolutely, especially religious traditions.
Yeah.
You know, in certain faiths, there is a period of time of mourning. Like you're in mourning for, say, 30 days or whatever it would be. And it's during that period that, according to the tradition, you're expected to have that outward appearance of mourning, of grief, of loss. And that again gets back to the black clothing, a veil for the women perhaps, black suit, black tie for the men. You know, there's all different types of things that apply.
And even other things, age, gender, sexual orientation.
Right.
There's so many other factors that who define us, and we all belong to different cultures, don't we?
We do, and within those cultures we are unique.
Yeah.
So each one of us expresses our grief, our mourning in our own way. And there's no right or wrong to it at all. It is what the individual needs to be able to get through this loss.
Yeah, I think that's such an important point. And you know, let's talk about the stages of grief a bit, and then we can go through some of the. I really want people to understand grief more, and we'll talk about that. And that uniqueness is something that I want to focus on as well.
Yes.
But talk a little bit, Bob, if you will, about the stages.
Absolutely. Over the past century or more, the medical and psychiatric communities have come up with what they figure are standard stages of human grief. And these are generalizations. So any individual may not experience all of them. They may only experience a small number of them. They're not in any particular order. It's basically what they have seen about how people respond to severe loss. And the first is shock. We're in shock. That person died. especially if it was unexpected.
Yeah.
If it was an individual who had a long-term illness, perhaps with a terminal diagnosis, it's expected that that person will die. But when someone dies accidentally, say in a motor vehicle crash or some other tragic event, that is totally unexpected.
Yeah.
One day they're with us live and well and talking and sharing life with us, and the next they're gone.
Yeah.
So it's that initial shock.
Yeah.
And people will react as if they are in shock. All of a sudden, time has stopped for them.
Yeah.
The world has stopped for them. So that is usually the first experience people have. Again, if it's someone you've expected that will be dying and over a long period of time had been, say, declining, there might be some pre-grieving that happens. In other words, anticipatory. We know this is coming. We know it's coming sooner than later. But when it's sudden, unexpected, it is a shock.
Yep.
The second that they list is the emotional release as a reaction to the loss and the shock.
Yep.
And I always like to tell people, you're not losing your mind. You're going to be thinking things and doing things and saying things that perhaps you've never done, said before. But then again, you haven't been in this type of grief before.
Right.
People who have had multiple losses in their lives, each loss is unique because the relationships we have with these people are unique to us and to them. People may understand, okay, and now I know why I feel this way. But for those who are experiencing for the first time, it is very, very distressing. Not only the distress of the trauma of the loss, but how am I handling this?
Right.
I'm not handling it. I don't know what to do. I don't know what I'm doing. That's why it's so important to have people around you, family and friends who know you, who love you, people you trust.
Yeah.
And also, I say this all the time, seek out professional help.
Yeah.
The first place to start is your medical doctor, your primary care physician.
Yep.
They know you, they know your history, they know the medications you're on, whatever. They're the place to start for help and assistance.
Yeah.
So beyond that too, we may find ourselves totally preoccupied with the person who's died. We talk about them all the time, and that's part of the processing.
Yeah.
Again, grief is a process. The reason they call it the stages is because it is a process that happens to help us adjust to the reality that that person is no longer with us in body.
Yeah.
And that's very hard. So we may be thinking about them a lot. We may make a shrine to them at home. None of this, by the way, is wrong.
Right.
It is just particular behaviors that individuals may exhibit. There is no right or wrong to grieving.
Yep.
That is something we always have to remember. And then we may have symptoms of physical and emotional distress, and we could have difficulty sleeping. Or we might be sleeping more than our norm. We might feel a tightness in our throat. Our appetite might change. We may eat more,
Right.
or we may eat less.
Yep.
We may lose interest in the things that motivated us in life, the things that were our passions.
Yeah.
Or we may get fixated on doing a certain thing and feeling that when we do this thing, we feel better doing it.
Yeah.
And the danger in all of this, of course, is if people turn to self-medication, whether it be with alcohol or drugs.
Right.
That we naturally want to make ourselves feel better. And we want to make that happen as soon as we can.
Right.
So people turn to those things, which are very, very dangerous and harmful.
Yeah.
That's why it's so important to have people around you
Right.
that are checking in on you, that care about you. And they're going to say, look, Bob, you went over there and you ate that whole bag of party-sized Doritos. I've never seen you do that before.
Yeah.
That is something I would do. But that's the type of thing when you have people who can look in from the outside
Yeah.
and notice the differences and the changes that we may not notice internally.
Yeah.
That is so very, very much, it's so helpful to have that.
Yeah.
Our behaviors may change. Maybe someone was very mild-mannered, very kind, very patient, and then now they're short-tempered, they can't stand certain things, or They may argue with their friends who have been friends for years.
Right.
They may nitpick. There's all sorts of different things.
Sure.
Changes in emotional behavior,
Yeah.
and especially in behaviors with other people that we've known for a long period of time.
Yeah.
Those changes are another stage of grief. We're angry at everything.
Yeah.
You know, anger is a big part of it. We're angry at the person for
Yeah.
dying.
Yeah.
We're angry for our friends for continuing on with their lives, or we're stuck there. You know,
Right.
it's all of that.
And it's so hard when people do express, because those are natural feelings and
Right.
all of that, but then people respond or they keep away.
Yes.
And not identifying it as grief, just thinking the person's just being difficult
They're
or
being difficult,
unpleasant, and that's
they've
not at all
changed.
what's going on.
Right. And that's another risk, is that people will withdraw from you.
Yes.
As well as the person who is in grief may withdraw from them. That's
Yeah.
another stage.
Yeah.
And it's important. The connections are important.
Yeah.
Everything in life, I have learned, is dependent upon good communication.
Exactly.
If we can't share with the people we love and care about, if we can't share with our friends, our coworkers, what is going on, if we can't communicate, it makes it more difficult for them to help us.
Right.
And it's more difficult for us to see our way clear. When you bring somebody in who can be objective,
Yeah.
yet they care about you, they're motivated by their care for you,
Yeah.
but they can look at you and honestly say to you, Bob, those Doritos were a bad idea.
Yeah.
You know, that sort of thing
Yeah.
is so important.
Yeah.
We cannot go this way alone.
Right. Yeah.
And that's one thing we do in the bereavement team that I'm on, the Bertillon Center for Grief and Healing,
Yeah.
is to help people realize they're not alone.
Yeah.
And we have professional counselors who can help them.
Yeah.
We do all sorts of programs. Again, ask for help.
Yeah.
Asking for help is not a sign of weakness,
Right.
it's a sign of strength.
Absolutely, and that's one of the last things people do who are grieving, right?
Oh, absolutely.
The other part of that too, Bob, isn't it, grief feels so isolating. You feel so alone.
Yes.
And it's almost like a self-fulfilled prophecy, isn't it? Because what happens is sometimes when we are having these emotions stirred, whether it be anger, and they're hard to be around, and when then people keep away, it almost like, again, we feel more alone.
Correct.
So
absolutely
it kind of
does that.
fuels itself, doesn't
Right.
it?
It's like a spiral.
That's where that communication piece comes in so much, because it's important for people to be able to say, look I know I'm not acting the way I usually do. I am just so sad.
I am
so
missing my loved one.
Yeah, yeah.
And it is devastated.
Yeah.
And I think that's important, to be able to be honest and say, I am really hurting.
Yeah.
I feel like I'm going off the rails.
Yeah.
I know I need help. Please, what can you do for me?
Yeah, yeah.
And that's so important.
Yeah.
But getting back to the stages, another stage is guilt.
Yeah.
We feel guilty.
Yeah.
We didn't do enough for the person. I hear that all the time from our clients.
Yeah.
Oh, what if I had done this? What if I had done that? Or maybe I shouldn't have done this, or shouldn't have said that.
Right.
We all second guess ourselves.
Yeah.
And hindsight, as they say, is 20/20. Yeah. The important thing to remember is all of that is the past. We cannot change the past, but we can change how we feel about the past and how the past is making us feel as we move forward in our life.
Yeah.
And that's very important.
We're so hardwired for guilt, Bob. It's
Well,
just we can do the best job in the world around anything, and we're going to find something. We're going to dig it up.
Now, you and I had parents of the greatest generation, and guilt was a big part of that. And
Yes.
I totally understand.
Yeah.
Well, and again, it was used as a teaching tool too.
Right.
But you're right. We do feel guilty.
Yeah.
I didn't do enough, or feel guilty that I'm alive and they're not.
Right. Yeah.
That's another aspect of it.
Yeah.
So it's trying to overcome that and say, wait a minute, you know what? You did everything you could. You brought in the people that could help you.
Yeah.
In the fire service, we have an expression: you play with the cards you're dealt. You don't complain. You don't throw the cards down on the table. You play it through.
Yeah.
And in doing so, we're giving the person a chance.
Yeah.
So I always say to my clients, you fought hard for your family member. You were there with them. You were caring for them personally. You brought in Care Dimensions to help. You brought in people that you knew could support you and get that loved one the care that they deserved.
Yeah.
Remember that.
Yeah. Yep.
I always say to people, we at Care Dimensions are an extension of their love for their loved one.
Yep.
Because we're providing the care for them that they can't do, because they're not nurses, they're not social workers, they're not spiritual counselors.
Yeah.
They're family.
Yep.
They're human beings.
Right.
And, you know, we are an extension of their love.
That's right.
That's something I always try to impress on.
Absolutely.
Yeah.
Yeah. You know, you had also mentioned that in terms of that anticipatory grief, you know, and I just want to talk a little bit about this, you know, because people will say, well, you know, for a loved one who may have had a long illness and they anticipatorily grieve for quite some time,
Yes.
and then they're shocked when the actual death occurs that their grief is so pronounced.
Right.
So they're not, you know, I want to just talk about that.
Sure.
That doesn't take the place.
You're absolutely right, and that phenomenon does happen.
Yeah.
We see it all the time. In my particular personal case, my mother had Alzheimer's dementia, and she had it, the doctors think, for 8 years. So I saw this decline. I didn't know what it was at the time, and this was back in the late 80s, early 90s, where we didn't know as much about the disease as we do now.
Yep.
But even though I was able to prepare myself over 8 years, when she died, it was devastating.
Correct, yeah.
Because this was my mother. This was the one who literally brought me into this world.
Yeah.
So we should not be surprised, or we should not be judgmental of ourselves.
Right.
As you would say, well, you have all this time to prepare. Well,
Yeah.
no one can truly completely prepare.
Yeah, exactly.
You know, that's the thing we have to remember. And again, as I said, there's no right or wrong to this.
Yeah.
It's the individual.
I want people to hear that because this is so important. People, we judge ourselves and we think we're not doing it right, as if it's not bad enough that you have the heaviest of hearts and you're grieving the loss of this person who is so important to you, or things that were important to you, or other, we grieve a lot of different things.
Yes.
But that we feel like we're not doing it right.
Right.
So we add that extra pressure on. There's no right or wrong.
There's no right or wrong.
And as you're saying, don't judge yourself, don't judge others.
No.
That people have to do it the way they need to do it.
Absolutely right. And grief is the loss of anything, whether it's the loss of a person, a relationship, a job, a house, a car, a prized possession. It's
hopes
loss.
and dreams.
Hopes and dreams. Hopes and dreams getting dashed, you know, for whatever reason. You're right. And it's loss.
Yeah.
It's all about loss.
Absolutely.
How do we contend with that loss?
And that's what anticipatory grief is, right?
Right.
It's from the moment we know, because we're also hardwired to form attachments as human beings. The majority of people form attachments.
Right.
From the moment we know that that attachment will be severed, we start to grieve.
You're absolutely right. That's exactly what happens. We do that consciously or subconsciously. It's happening.
That's right.
And that's why it's so important when you have a care team taking care of your loved one. You have a nurse and an aide who are doing a wonderful job of dealing with the medical and physical needs. You have the social worker who's helping you with the anticipatory grief, things like that, as well as helping you prepare, making sure everything is in place the way it should be, are willing to listen and reflect with the person, and also the spiritual counselor who is there to address their faith issues.
Right.
And the great thing about the spiritual counselors is they're interfaith.
Yeah.
You know, they may be from a particular religion, but they're very special people because they realize they're not there to proselytize. They're there to walk with the person, whether it's the patient or the family, in whatever tradition they have, or even if they have no tradition.
Right.
You know,
Exactly.
It's very important to remember that this is all people coming not just to provide medical care, which is so important for the patient, but to provide support for the patient and the family too.
So that's when people are on hospice care, that's one of the wonderful things, is that one of the things that they receive is the bereavement support for at least 13 months following the death of the person, and that's for those who are left behind. So, and some people will need that even beyond that 13 months, but that gets you through all of the firsts, including the anniversary date. But some people will need it longer than that, which is fine. Again, there's no right or wrong. And that's the other thing, Bob. I want people to understand there's no timetable. You know, I actually believe that grief is lifelong.
It is.
And the goal is not for it to get over it, but for it to become more tolerable with time.
That's the whole point, is adapting to a new normal, a new reality, which is not easy to do. We, as a human race, we've adapted 2 world wars in the 20th century, 9/11, the pandemic.
Yes.
You know, all these things that changed our life and changed the world around us.
Right.
We're still here.
Right.
Because I believe in the human spirit. The human spirit is very adaptable.
Yeah.
And we're here because we're together.
Yeah.
We help each other get
Yeah.
through it. That's what's so important.
And I think that is a big piece to it,
Yeah.
is that, there's a quote that says, grief shared is grief diminished. We need
Yes.
to do this together. We're all about community, right? And
You're
that's what
absolutely
human
right.
beings do. And,
Yeah.
I think it's hard for people because, again, it's so isolating. So we actually need to push ourselves beyond our comfort zone sometimes to reach out.
Right. And I love that quote you just shared about grief shared is grief diminished. The thing to remember about that is the words that whoever wrote that put in there about diminished. It doesn't say grief goes away.
Right.
It's diminished.
Yeah.
Its effect on us is mitigated.
Yes.
And we're helped to get through. We cannot forget these people.
Yeah.
We shouldn't. We shouldn't want to.
Right.
They're part of us.
Yeah.
Especially if it's a parent or a sibling, a grandparent, uncle, aunt, whatever.
Yeah.
Close friend, a spouse, a partner, someone who shared very, very important parts of our life. You don't move on.
Right.
You move forward.
Correct.
This is something we encourage people to do, is remember, life is a journey.
Mm-hmm.
You're pausing right now because you've had this terrible loss.
Mm-hmm.
But eventually, through good self-care and getting help from professionals and being honest and open and communicative with yourself as well as others, you will adapt to the new normal. It will take time and effort. The old expression, time heals all wounds, it's true, but not by itself.
Right.
Time and effort will heal the wound.
Yeah.
The wound may have a scar. I have scars on my body from stupid things I did when I was a kid. They are always reminders to me.
Yeah.
That happened,
Yep.
but I'm still here.
Yeah.
And I'm still going.
Yeah. I don't know if you've seen the movie Tuesdays with Morrie, but it's one of my
I read the
favorite
book too.
movies,
Yeah.
and also one of my greatest teaching tools that I
Yes.
use in education.
Right.
And one of the lines in that, Bob, is that death ends a life, not a relationship. And as you were saying that to me, those last and to our audience, it reminded me of that. Because that person is part of those stages. It's not, we don't go on without the person. We develop a new relationship with the deceased, and they are forever a part of us.
Absolutely right.
So
and that's the thing to remember. When we're talking about these stages, it's not all negative.
Right.
It's not all difficult or traumatic. It is a process to get to a place where we put that relationship into perspective.
Yeah.
Okay, they're not here with us in body, but they'll always be in our heart. They'll always be in our mind.
Yes.
They'll always be in those beautiful pictures we have, and the videos and whatever we have.
Yeah.
All of that, in the love letters we wrote to each other, and all of these things.
Absolutely.
The relationship does not die.
Yeah.
Neither does the love.
Right.
And that's part of that relationship.
Yeah.
We still love them,
Absolutely.
and that's what's important.
Yeah.
As we come through this process, and whatever time it may take, we come to a point of readjustment.
Right.
And so I always say to people, there is a light at the end of the tunnel, and it's not the headlight of an approaching train.
Right.
There is a light. You will get there.
Yeah.
Please, as much as you may think, I have to give up, I can't do this, or it's just too much, or I don't see that light. Well, you don't see it yet, but it's there.
Right.
And the people you love, who care about you, are the people holding that light.
Right. Yeah.
So go to them,
Yeah.
and they will help you.
Yeah, and I just want to, emphasize too, because you brought this up, and certainly when people are on hospice services with care and mentioned, they're going to get that bereavement follow-up and all. But as you had, but we also provide support to the community as well, even if people are not on service. But it's important. Support groups.
I love support groups. We love support groups. We do them all year round, especially the loss of spouse and partner.
Yeah.
There's always a high demand for that.
Yeah.
But we've done specialty groups, people who have lost adult children, people who have lost a loved one to suicide, people who have lost a parent. And we have a wonderful child life team that works with the families who have lost children and works with children who have lost parents or siblings. Yeah. So there is so much support out here, and even beyond us. As you mentioned, we follow our families for 13 months after the date of the death of their loved one. Yeah. And in that time, we offer 3 one-hour counseling sessions with a qualified counselor, grief counselor, specializes in bereavement. We have workshops that we do. Some of them are online, some of them are in person. Support groups that I just mentioned. Again, we try to accommodate with people with online and in person.
Yeah.
Those are critical. And the reason those are critical, especially the support groups, is people come together of like experience and like mind.
Right.
They've lost a spouse. They've lost a partner, they've lost a child, they've lost a daughter or son, and they're with other people who have lost the same thing.
Yeah.
And that is where real, incredible healing happens.
Yeah.
And guess what? It's not because of me or any of the facilitators that happens. It's because of the group.
Yeah.
They heal each other.
Yeah.
You know, it's like we start the ball rolling, so to speak, and they take it. And I have seen, and my colleagues have seen, incredible friendships formed.
Yeah.
That go on for years.
Yeah.
It's just incredible.
Which is wonderful, and that's the thing, is that, and everybody, even though they have a similar type of loss, they're all unique still, like, just as you have said. And but I think, you know, to be able, and it's hard for people sometimes. I know I'm not into this. I'm gonna give it a try.
Right.
Give it a try.
Yes.
Don't go it alone. Right. This is one of the biggest things that people say. You know, David Kessler is a grief expert. You know, he says that, you know, the grief doesn't get smaller. We become bigger than it.
That's right.
We need to grow around it.
Right.
And I think that that's an important piece too.
Absolutely right. And his colleague, the late Dr. Kubler-Ross, who's considered sort of the mother of hospice in our country, she and he worked together on many books about grief, death, loss, and grief. And they stress that we will always be in grief. And it's not something to be afraid of, because it changes over time.
Right.
Like you said, grief shared is grief diminished.
Yes.
And there will always be people like you and I, and the people we work with, that will be there to help.
Absolutely. Yeah, grief is dynamic. It's the way we feel right now is not the way we're going to feel even in a short time.
Right.
And that's why, again, it's so important for people to feel that. You know, so I know that we have just a short time left, Bob, and we will be putting the number up for the the Bertillon Center for Grief and Healing, so that people can access that information. But again, I want you to be able to talk about more things. We have a little bit time left in this time, and we could go on and on for a week with this and scratch the surface, Bob.
Right.
But you know, I think that just some tips like that are helpful about, again, that there's no such thing as, you know, everybody's grief isn't the same.
Right.
They're not going to react, you know, all of those things, that there's no timetable. So add some other things just to highlight for the audience.
Well, you know, the wonderful thing about the suggestions we have for how to help people heal, because grieving is a healing process.
Right.
You're healing from a loss. All of these things that we talk about are good for everyday life.
Yeah.
Good restorative sleep.
Yeah.
You know, there are some people who need only 5 hours of sleep a night. There's others who need 10.
Right.
You know what your baseline was before the loss. What is it now? Making sure you're getting that good REM sleep that helps our body rebuild and helps our mind refresh.
Yeah.
That's very important. Good nutrition. Good protein. People think, oh, protein is for our muscles. That's not just for our muscles, it's for our brain. We need that. And of course, if the people could see the rest of me, they know that I'm a proponent of comfort food. Comfort food in moderation, of course. And then the next would be good physical exercise. And, you know, it doesn't mean you have to go to the gym and pump iron. If you want to do that, that's fine. Just 20 minutes a day of a constant walk. Not a walk like I had a dog, and that doesn't count because you have to stop everywhere because the dog has to check messages. You know, you need a constant minimum 20 minutes.
Yeah.
And you don't have to run, you know, it can be a good steady walk.
Yeah.
That's important. And then lastly, the social connection.
Yeah.
Again, we are people who need people, like Barbara Streisand's song says. It's my favorite song of hers. We need each other.
Yeah.
Maintaining those social connections, and no question, they will change.
Yeah.
Especially if we are with a spouse, we go from 2 to 1.
Yeah.
And that's very, very hard to do.
Absolutely.
And especially if we were together with other couples, maybe we got together for dinners and events or whatever, we feel like the odd person out. No, if they love you, they will help, they will tell you, they will show you, they will embrace you, and they will say, you still belong here.
Absolutely.
So keeping those connections is so important.
Bob, thank you so very much. Again, this is a topic that is just, we could go on and on with, and we should, and we will. This will always be a topic that we talk about, that we focus on, because this is so important to our audience and to all of us. And I want to thank you so much for being here with us today to talk about this really important topic.
Very welcome, and thank you for all you do to let so many people know they can be helped.
Thank you, Bob.
You're welcome.
And thanks for tuning in, everybody. And we look forward to you tuning in to our next show on Timing is Everything.
A lot of people think that hospice is bringing somebody on in the last few days of life, and that may be true in some instances, but we really like to be able to bring people on a little bit early so that they can really benefit from our whole interdisciplinary team.
Hospice really is a supportive services that can really help enhance the quality of life for patients and families. And that, again, it helps to give them a little bit more control over a situation that they may not necessarily feel in control of.
We focus on comfort, and we focus on allowing patients to spend the time enjoying their lives, doing the things that they enjoy.
You literally just pick up the phone and call them and they answer. Or if you, even in the middle of the night, I tell families, if you need somebody, you have a question, you're unsure about something, call. You're not bothering anybody. There's always somebody available.
Because we are expert, we know what to do. This is what we do to help people. If you are going through something there and you need help, we are here to help, and we are very good at it.